Hi, I'm Dr. Darren Howarth with Summit to Shore Chiropractic, and this month we're going to be focusing on moving well, moving often, and making sure that you're doing things that can keep you moving for a long time. So first off, addressing what is soft tissue trauma and what is soft tissue. So first off, soft tissue is muscle, ligament, tendon. It's the more pliable objects versus the bones themselves. And the big thing, according to the Bureau of Labor and Statistics, the most common workplace injury is sprains and strains, which is involving ligaments and muscles and tendons. And so it's common that we injure these in just our regular workplace, just between overuse type injuries or the stretching or just not ready for it, whatever the case may be. But going into kind of what's going on, so I always like to explain it as ligaments are kind of like a plastic bag. So they're going to stretch, but they don't really go back the way that they started very quickly. They're not, versus a muscle is more like a rubber band. They're going to stretch, they go back. They stretch, they go back. So there's a little bit of lag time on the ligaments. So they'll stretch, but it takes them a while to kind of get back to where they are. And then again, adding on top of that is this idea of, so ligaments, muscles and ligaments kind of, they go in a certain orientation. And so for example's sake, if I were to tear a ligament, in order to fix it, my body goes back and it puts down a weave, and it puts down as fast as possible all these collagen fibers, and then instead of a nice smooth weave like this, you get more of this kind of tangled up webbing. And that in and of itself can cause some of that residual pain that lasts for a long time. It's part of the healing process, but at the same time trying to get that to move in and out. So that's where some of these treatments come into play, and not just, well, I'm just going to let it heal and it'll go away. It's going to heal, it's still strong, but is it able to move freely when it's like this versus if it's like that? Now, hopefully that makes sense. But this idea of being able to treat the soft tissue and get the soft tissue to move differently goes a long ways in trying to get you healthy, get you moving well. So we've got a lot of different options here that we do, just depending on what treatment you're needing. Obviously exercise and movement is a big part of it. The Graston, the cupping, the taping, compression, a lot of different aspects, but we're gonna share some more of those in some of these next videos. But hopefully that can answer a few questions on soft tissue and what it actually is, what's actually getting injured, and a start on how you can start getting yourself feeling better. Hopefully that helps, and let us know if you have any questions, need anything. Feel free to call or email, and we'll talk to you soon. Thanks.